diversity series. I want to sort of thank Ina and Max and the whole team for putting on the event. And I want to welcome Dr. George Alvarado, who many of you know as one of our behavioral health experts, pediatric behavioral health scientist, has overseen a lot of our work in the health home and also in our practice-based behavioral health programs. So I do want to thank George. This is an incredibly important topic around sort of really the human condition and our individual responses to times of crisis and how we can best position ourselves and best help our membership and our patients at this moment. So thanks all for joining in, and I will hand it over to George.
Okay, so thanks very much, Zena, for that introduction, and really just for the opportunity to be able to talk to the teams about this. And I think, at every level, our teams have been identifying these questions, addressing them, and there's really a lot of information out there, even just about behavioral health. What are some of the issues that could come up? What's the best way, to approach some of this? So what I was really trying to do with this presentation is just try to curate some of that and really identify, what are some of the most common themes? What are some of the good resources? What are some of the linkages that are out there? And put them together in one place, really review that today, and then give everyone an opportunity at the end, to answer questions. And also acknowledging that, this is going to be an ongoing dialogue, and there may be, a 2.0 version of this talk or additional opportunities. Also, if there are any particular teams where you have members who are not able to join, or you think it would be helpful, to meet with myself or Dr. Sappa or other folks, we're very open and available, to doing that, and really just to supporting our health solutions care management teams in any way that we can. So really moving to the first slide, this is just an overview, and at this point we're all deeply familiar, with the effects of the pandemic, particularly on physical health, also the impact on economics, on jobs, on school life. And I think it really brings to the forefront this idea that, all these things are interconnected and integrated and affecting each other. So, as much as the coronavirus, is going to cause physical symptoms, and many who don't even develop physical symptoms, it's also leading to lots of psychological symptoms, disruption in social routines, disruption in work. And really, there are a lot of secondary effects that are coming out as a result of this, both to those who were directly affected by the virus, but even those that, will never suffer from any symptoms. And, how to really talk about that. How do we think about that? And how do we think about this in a longer term? Because as opposed to some other disasters that we've dealt with, hurricanes or, significant snowstorms, or even, terrorist attacks, other things, they're usually in a kind of a brief moment in time, and then, they resolve. The difference here is just how sustained this, crisis is, and really, this language of thinking about it as a marathon rather than a sprint, and then how we need to adjust our thinking and our coping and our messaging around that to really best support our teams, best support the members in our programs, and to best support one another. So the next slide, I think this is really useful. This is coming from the American Psychiatric Association. They just gave a talk on this, and some of the common themes that we see come up. And, at the top of the list is this whole idea of fear and uncertainty. Could this happen to me or to someone that I love? And again, with anxiety, it's that tendency for someone's mind to go to the worst case scenario or to go to the what ifs, right? The next is, an altered perception of risk. So for instance, imagining that our risk is, much higher than it may be, right? And again, like many people, even if they develop symptoms, they're going to be mild to moderate symptoms. That's going to be 80% of individuals, and that's been, widely talked about, and it's also talked about in other talks at COVID University. But, that worry, well, what if, I experience symptoms that are worse than that? How do you manage that? Novelty with just this being this unfamiliar situation. really also disruptions in just day-to-day routines, going to school, going to work, having a sense of normalcy. All of those things have changed. And then I think also the nature of kind of some of the testing itself. Sometimes people are not able to get testing, or even if they have gotten testing, the fact that they may be sent home under quarantine. So they're still going to have anxiety during that period of time. Well, you know, I've gotten this test, it's come back positive, but it can't be in the hospital. So, and these are probably questions which folks are already hearing and fielding. So I'm hoping we could talk about some more of these themes in this presentation. So one of the other things in this next slide is I think thinking about the role of media and what's out there, and media can be extremely useful in terms of sharing information, and it's really a vital function in our society. At the same time, I think there's very much of a tendency right now sometimes to veer towards sensationalism, or focusing excessively on the worst case scenario. And like literally, I mean, one of the titles of some of the articles are "The Sky is Falling," or terms like "the apocalypse." And these are headlines, and these are things that grab people's attention, and these are stories that people share a lot. But very often, I think they're really focusing on specific instances or outlier cases, not necessarily telling the whole story. I think the hospital story that came out of Elmhurst yesterday caused lots of anxiety. And I think the tendency is to take that story and then extrapolate that, and then to assume that every single hospital is experiencing that exact same experience, when it's not. There may actually be, there are more resources, there are more options, there is more hope that we will pull through this. But sometimes the language of these things are, it's all over, there's no hope, there's nothing we can do. And that's really one of the things I think just psychologically we want to be guarding against. So just this slide, stress and coping 101. Everyone reacts differently to stressful situations. When placed in a situation like this, some of the common symptoms can include excessive fear and worry, change in sleeping or eating habits, difficulty sleeping or concentrating, worsening of some chronic health problems, increased use of alcohol, tobacco, or other drugs. And I think to an extent, many, if not most people, are going to experience some combination of these symptoms. And those in and of themselves are not, pathological, right? They really start to become a problem when they're kind of in excess, when folks really can't function as a result of that. But kind of thinking about, what are the basics with coping, this whole idea of resilience. So we could be going through a very difficult time, but, even after enduring that stress, that we could pick ourselves up and keep going and keep on helping those, that rely on us, helping one another and taking care of ourselves. And some of the basics here are just common sense measures: hand washing, getting enough sleep, maintaining a healthy diet, trying to get some regular exercise. So that sense of normalcy and self-care is, very important. Also, filtering media content, which I was just referring to. Again, like and we've all heard this before, but sometimes it's difficult to, turn the news off or to not refresh your news feed and continue to read these stories, which often are not necessarily helpful for the immediate work that we need to be doing. Maintaining social connectedness, helping to support others, family members, friends, neighbors who may be dealing with, material concerns, psychological concerns, and to the extent that you can, trying to instill some sense of order, routine, and normalcy, even in the new circumstances. So being able to control those things in your span of control, and so not spending as much time worrying about the what ifs. And again, that's, sometimes easier to give that advice than to practice that advice, but I think that's really going to be, one of the core themes going forward, both for ourselves and, for all the folks that work with us. And finally, fostering hope. I think even when we watch some of the videos, coming from Michael Dowling, from other leaders, from Governor Cuomo, I think they're very good at this messaging of, we will get through this, and really bringing us back to that, again, that core resilience and hope, which is really going to be essential, which sometimes, when you contrast it with, again, those news stories and things that are, sometimes making us feel more hopeless and powerless. So really trying to balance those two things. The next step I wanted to talk about was, when does that stress point really kind of cross the threshold? And that's when, it's known as maladaptive stress. And that's at the point when it's to the point the person can't function, it's causing suicidal thoughts, it's threatening their health or safety, and that there are some groups that may be at increased risk for this. That includes, the elderly or folks who are more socially isolated or ill to begin with, those with chronic disease. Children and teenagers could experience particular, difficulties during this time, especially with the loss of school. Those who are responding, first responders to the COVID response, nurses, doctors, emergency medical technicians, and then also those who have mental health conditions. And I wanted to talk more about some of these subgroups in this talk because these are all folks that we're going to be care managing, and how do we do that work better and support them better. And again, like when we're talking about these groups, I think this is to just bring us back to our core mission within Health Solutions, which is helping those who need it the most. And those groups that I was just mentioning, those are among the groups that need it the most. And even though a lot of our work currently is remote, that if we're able to make a timely phone call, reach out to someone, help make sure they get their medications, help make sure that their material needs, that they get food if they need it, even just being able to listen to them to vent for a while could really go a long way. Because among the two most important things the health system is looking for from us is to help keep people from going to the hospital if they don't need to, and help maintain them in the community. And I think really focusing and supporting their psychological health is going to be an important part of that, because if folks are panicking, that in and of itself could lead to more needless ED visits or other types of problems, which, at this point, the more we can address it, the more we can support our folks, the more important that's going to be. So talking about children and adolescents, again, I already mentioned schools are canceled, activities, sports, a lot of the outlets that kids have are not there, and that really adds a lot of challenge. Insufficient physical activity, irregular sleep patterns, increased boredom and frustration. I mean, I'm dealing with this directly as I have a 5-year-old who's been off from school for going on 2 weeks. Some of you guys may have heard him already earlier yelling in the background during this talk. And so you're kind of dealing with this firsthand, and sometimes trying to juggle, work from home with caring for a child. And so again, this could be exacerbated if the child has an underlying behavioral health condition, if they have ADHD, if the child has anxiety or other issues. Kind of being at home or kind of dealing with all of this stuff coming through the media, that can certainly exacerbate this. So some of the basics are really kind of bringing it back to the parents. Or whoever the primary caregiver is. If that individual is struggling, if they're anxious, if they're overwhelmed, it's going to be that much harder for them to support the child. So even thinking from a care management lens, how can we best support the parent in terms of their needs so that they can, support their children. For the parents, very important to try to model healthy coping behaviors, provide a supportive environment where kids can ask questions. When they're ready, we don't have to talk to kids about this if they're not asking, but when they are, trying to answer that in a straightforward way, trying to keep up routines or develop new routines to the extent that we can. Things like screen time, there are some questions about that. I think a lot of that is going to go out the window during this time. There is going to be more screen time that's used, but still trying to balance that out to the extent you can with exercise, with some learning, and with just some quality time between the parent and child. And then, trying to plan some enjoyable activities during the week. This next slide, tips for talking to kids, this is actually an article that was written by Victor Fornari from the Division of Child Psych, talking about how do we talk with our kids. This is in the Well for Northwell. So using appropriate language, being reassuring, answering their questions directly, I think the fourth point, being a fact checker, so clearing up any misinformation or rumors they may have heard from friends or social media, and also being honest about what we know, what we don't know. And even looking at these facts, I don't think they're just restricted for talking to kids. I think they could really be extrapolated to our interactions with really any of our patients or other individuals, just in terms of having a frank, honest conversation about what's going on. Another kind of new situation that we're facing, folks who are under quarantine, either because they've had a sick contact, they themselves are coming out of the hospital, or even if you extend it just to folks who are now socially distancing, trying to prevent infection, or they're working remotely from home. So again, just this isolation can increase anxiety, it can increase depression, it can contribute to things like insomnia, fatigue, diminished work performance. Again, this same like with kids, the whole idea of trying to reestablish a routine, being able to have healthy communication with others, have a sense of connectedness, facilitate communication with loved ones, try to reduce boredom and isolation, and sometimes thinking outside of the box in terms of hobbies or crafting or other, playing a musical instrument, listening to music, but sort of thinking out of the box, things that people may not have done for a long time. But if they're stuck with lots of time on their hands, it's better for them to be occupying themselves with some type of activity that will reduce their stress, rather than necessarily just sitting there, with the news on. And again, trying to create a structured environment in this new setting. Now, the next slide, I really want to focus on this group a little bit more. So those with pre-existing behavioral health conditions, because these are folks who are likely to be hit harder by everything that's going on. So one group is those with PTSD. So if folks have lived through other disasters, Hurricane Sandy, 9/11, other kind of large-scale disruptions, this may already be triggering for them. And so it's going to increase their anxiety, increase insomnia. And then if you layer on top of that them having physical symptoms, then their anxiety often goes through the roof, right? Also, just anecdotally, this might be that person that's going to be very likely to kind of rush to the ED when they don't need to do it. And in part, that's because of PTSD and what that does to your stress response system. So the whole idea of fight or flight, faced with a threat, their anxiety, goes through the roof, and they want to spring into action mode and make sure that they're safe. But sometimes, that's going to really overwhelm what's necessary for the response. The other group to think about are those with chronic behavioral health conditions, schizophrenia, bipolar disorder, depression, and these are folks that typically, if they're plugged into treatment, they're going regularly to see their to get medication, to see their therapist. They have social supports, and these things are essential for them to function in the community. Now, with the disruption, most clinics have closed. They're not able to do that. So there's potential to not get meds filled and to really decompensate. So reaching out to these individuals, if you know that they're on your panel, if you know someone has these comorbidities, thinking about that, how are those needs going to be addressed? I also have just a brief kind of vignette here on the side that I got from the media that was talking about a single mother of two, customer service for a medical service company, and the job helped her stay busy and distracted from traumatic thoughts. But since her employer had asked her to start working from home last week, which she couldn't do because she doesn't own a laptop, she spends time worrying that all the progress she's made escaping from an abusive relationship is starting to unravel. So that basically, again, like work and other things that we do in our normal routine, they could be very essential to coping. And if folks are losing that, what can they do to help them continue to be resilient? And those could be very useful conversations, I think, for us to have. Other challenges for those with chronic medical illness, again, medications, which we talked about, access issues. So particularly, there are certain folks that receive long-acting injectable medications or other medicines that need blood level monitoring. So if those issues are coming up, or even if they are and you're not certain of how to deal with it, these are things certainly you could reach out to myself, you could reach out to Dr. Sapra, and we could just help kind of think through, what would be necessary and what would be the next step. And then actually thinking about what treatment resources are out there for behavioral health. So a large effort going on right now in nearly all clinics to convert treatment modalities from face-to-face to either telephonic or telepsychiatry. A lot of clinics are sort of in the middle of that transition, but some are starting to come online with it. I think the challenge becomes, how accessible are they at this point? So they're trying to, implement those services for the patients they already have. But if you have a new patient that needs a referral, how are you going to get them there? I think they are going to figure this out, and this is going to become clear over time. But right now, I think there could be some, disruptions in service. So checking in with them, are they able to get in touch with the therapist, with the psychiatrist? Do they know, when their next visit is going to be? Because all those things should be coming into place. Zucker Hillside Hospital is itself doing a similar transformation. They're moving to telehealth services, and also our own behavioral health care management team, which supports the physician partner, pediatric and adult practices. We're currently supporting by phone, but starting to move towards telepsych, and then should have all of our care managers up to a telepsych capacity within the next couple of weeks. And I also, Dr. Manish Sapra is also on the phone. I just wanted to give him an opportunity to talk a little bit more about Zucker and some of the services that are going on over there. Manish, are you on?
Yes, hi, can you hear me?
Yep.
Yeah. So thanks, George. I think you covered most of it, which is basically overnight, folks are figuring out how to provide services remotely via telephone or via telepsychiatry. This is essentially the workflow now for 70 to 80% of the patients coming to the outpatient clinics at Zucker Hillside, and some of the other clinics that are operated by the behavioral health service line. The crisis centers, as you may be aware, there's one at Cohen's and one at Zucker Hillside. They're also still operational. We just received word yesterday that Zucker Hillside Crisis Center is now open only till 3 p.m. So it's 9 a.m. to 3 p.m. But they are still accepting walk-in patients. We are doing a lot of virtual visits at the Cohen Surgery Center. Apart from that, the behavioral health service line and we here at Health Solutions are collaborating to support EAP. So if folks are reaching out to the EAP and they need, further connection to services out in the community, or if there is any help we can provide using our tele resources, we are standing, with the EAP in helping them, and we've already started receiving some referrals around that. On the partial hospital and the group setting, I know the clinics are working to get capabilities to use Zoom or tele through Northwell's platform to do group therapies and also provide some services through partial. The substance use clinics, which are really essential at this time, as there is a high risk for folks to relapse and maintain sobriety in this stressful time, and also with disruption of supplies that they would get otherwise. So the methadone clinics and other substance clinics are still operational at Zucker Hillside and still doing a lot of work actually in person. So I'll stop there, and later we can take questions.
Okay, thanks, Manish. I also want to, on this slide, just highlight the email address on the bottom, which is for the behavioral health care management team, that if any of the teams had specific questions about referral or resource questions, please email that to that address, and we can get in touch and we could help with coordinations and connections. Because again, the usual kind of bets are off at this point, and kind of negotiating mental health services and getting folks in front of the right clinician at the right time may be a little bit trickier. But, just to reiterate what Manish said, Zucker Hillside Crisis Center is still open, and the Cohen's Behavioral Health Center for Children, that is open as well, and they are actually doing some telehealth visits also. So if you have a child that's in crisis, there may be an opportunity for them to even just do that visit from their home. So if anyone has questions about that, you could also contact me directly. The next service I want to talk about, this is coming from the ESPER team. So that's screening, brief intervention, referral to treatment. This team is typically embedded in our EDs and clinics, really helping identify folks with substance abuse concerns and connecting them to treatment. They have also moved to a telephonic model, and they would be another great resource. Like Manish mentioned, right now with all the added stress and things I was talking about, this could really be a critical period when a lot of people relapse in terms of alcohol or other drugs. So if you have members where that's a concern, ESPER would be a great resource to connect them to. And finally, thinking about crises, as much as we want to avoid sending patients to the ED, the common psychiatric emergencies, suicidality, psychosis, mania, if you think someone is going through those things, they still need to go to the ED. Psychiatric hospitals are still open. And I bring that up because that question actually come up during the week, like, should we just be having a higher or different threshold for patients who are a threat to themselves or others? And the answer to that is, it has to be the same if we're talking about a risk to their own life or someone else's life. If they need to go to the hospital, if they need to be hospitalized, those resources still exist, and we still want to think about that. But again, here I'm listing the Zucker Hillside Crisis Center is still open with the modified hours, Cohen's Children's, and also the Family Service League runs a crisis center called DASH that's out in Suffolk. As of earlier this week, they're still open, they're still accepting patients, and that could be another useful place for behavioral health crises. And again, these are alternatives to the ER. Now, we're drawing to the close of the presentation. One of the other areas which is useful to think about, and this could be very helpful to team members throughout the different care management teams, this whole concept of psychological first aid. Many of you may have already had this type of training, but really focus on safety, calming, self and community efficacy, connectedness, and hope and optimism. So all the themes that we were talking about in this talk, and again, that's a very useful skill set. So when you get that person on the phone who's really at home and they're freaking out because of the news or because they came back from the hospital and couldn't get a test, or they came back from the hospital and they tested positive and now they don't know what to do, so talking through some of these things, in addition to all the other core functions we're doing in care management, I think that's really going to be an essential, element and core competency throughout this crisis. There are actually great resources available through the American Psychiatric Association. They have a mobile app, online training. These things are available free of charge. So if you think this would be helpful, so please go ahead. And it could be really, it's not just within the care management context, it could be used broadly, and really anyone who's working frontline with patients, it's a very useful tool. This is just a listing of some additional resources, for patients, something called the SAMHSA Disaster Distress Helpline, so toll-free that they could call. NAMI, National Alliance for Mental Illness, also has a toll-free number. I also listed a lot of the sites that we got the information from this for this presentation for, if you wanted to just go there and look for additional resources. I also want to close with the Employee Assistance Program. If we ourselves or colleagues are struggling with these issues, I know EAP has already given several presentations about this, and they will continue to do so. But really thinking about self-care, this is an important resource to have. Finally, Northwell also has an app for employees called Joyable, which could again help with self-care and really kind of coping through this time. And the last area which I want to end on, this is actually coming directly from the Northwell Health website, again, closing on the issue of hope and resilience, that we will get through this, that we will work together to support each other to do that. and that there may be a lot of challenges that are going to face us, but we will be able to overcome them. And the more we're able to talk through that and support each other, the stronger we'll be. So I want to end there and open it up to any questions or other comments that folks might want to make. Thank you.
So thank you so much, George. That was really tremendous. You got through a lot of material in 35 minutes, so we do have some time. Unfortunately, I will comment, and Max, I don't know if you can also jump in here. I cannot, it's hard to see if there are questions there. Are there any questions? And if not, certainly jump in and throw questions into the Q&A because we do have a fair amount of time kind of left over.
Hey everyone, it's Max. Just to clarify, there are no questions yet. We did have a couple questions in the beginning, but nobody has asked one since. So enter those into the Q&A if you want.
And then potentially, George and Manish, now knowing that we have a little bit of extra time, if there are any kind of other aspects of this that you sort of want to emphasize or any vignettes that you might think would underscore some of these points, certainly there is opportunity to do that now.
Hey, this is Manish. So one of the things I would say is that there may be some hesitation that at least, anecdotally I am hearing about reaching out to EAP if folks are struggling themselves. So I would like to say that please do not have any such hesitation if you or a family member who could benefit from that to reach out to EAP. As I said, we are also standing by to help EAP around that. And if you do reach out and if you still have any hesitations on receiving services, EAP does connect folks to non-Northwell entities. There has been an attempt to increase the coverage available to our employees. Our employee health plan has recently agreed to reimburse physicians, therapists, for services via tele and even telephonically. And we have worked through our premium network to reach out to those providers and inform them about that, and also added those kind of services and modalities within the service line. So I just want to mention that to emphasize, to keep a low threshold. If folks can get some help, please ask for it.
Hey everyone, we did have one question in the chat, so I will read that out and maybe one of our presenters can answer it. It's a little bit lengthy, so with all the news about coronavirus on the news and people dying and having to attempt to screen the member as to why they need the test, that fear tends to creep in once you realize your member was exposed due to the member's spouse being a healthcare worker who was exposed to her patient who tested positive for the virus. Lucky for me, I have a wonderful supervisor that was able to help me through the process. My question is, how do I keep down my own fears about the virus so I can stay calm enough to assist the members while also assisting the member? Question.
Mm-hmm. Yeah, I think that is like kind of the central question that I think a lot of us that's coming up. And I think, Zena, you and Manish, I'd be really interested in your input on this one too. But one of the things I bring back with the BH team, I talked about this with the health home team as well, as I think also thinking about kind of what we know about the illness. So like at this point, if there's pretty common transmission within the community, that means a number of people, a large amount of people may actually come down with the illness. However, of those, 80% are going to have mild to moderate illness. And even, among those, of the 20% that require, more intervention, only 5% will become seriously ill. And of those, a much smaller amount, will actually suffer from mortality. Now, that being said, so those are the numbers, and that doesn't solve all of your kind of questions or all of your fears, but I think it's useful to keep that in the back of your mind and kind of use that as a touchstone, because that there are going to be infections, there are going to be people that get this, there are going to be people that are hospitalized, but overall, if we focus mainly on just kind of the bad outcomes or those stories, which is a lot of what I think, again, going back to the media and the press coverage, it's really zeroing in on that. But that is probably not the prevalent or the experience of many. Countering that with, those who are at high risk, so the elderly, those with chronic conditions, those who are immunocompromised, they really have to take much higher precautions. But for those that do not, share those conditions, that their risk is different, and that may be very helpful to think about when you're dealing with some of these fears. But I'm really curious what others would have to say.
Yeah, I mean, I think, George, you answered that really expertly, and you are the expert, so that's good. I think, again, I want to first just acknowledge that is the normal response. This is not easy. This is totally new for the entire country, and it's especially, we're especially feeling it in New York City. So to have a response that is fearful is normal, and I think stopping to just acknowledge, I am afraid right now, and that is okay, because that is the right response when things are, new, different, scary. I'm seeing different things on the news. I think that just like in other scenarios, what bravery is, if you're not scared, then there is no bravery or heroism. And I think as a supervisor and as leaders, I think and I think where sort of the Northwell and some of the other kind of advertisements around New York and the response are getting at is that it is in these times of crisis where we are all the leaders and we are the heroes. And fear, we, and the phrase "fake it till you make it" is not the medically approved phrase, but it is this thing of saying, I am afraid right now, but as I'm having this conversation with my teammate, with my child, with people in my family, I'm going to, as George said, sort of rely on the things I know to be real, rely on the facts as I know them, and reassure myself as I'm reassuring the person next to me. And not have an unrealistic expectation that you're going to not be afraid, but have sort of a plan and language around reassurance that will help the people around you, and in turn help to sort of calm your own kind of thinking around these things. Again, very non-medical approach.
Thank you, guys. So we saw two more questions pop in, so I'll read them both. First question, how can members with no insurance get testing done for free? And second question, can you please review hours for in-person services at adult and pediatric behavioral health urgent care? Are there additional telepsych services outside these hours at these crisis centers?
Sure. So, Zena, do you want to take the first one about the testing?
Sure. So this is a really good question. So number one, it is the same as in non-COVID times. If a person is needing urgent medical care, they are to go to the ED, and George and Manish both made this point. When people are acutely ill and need emergent services, they have to go and get emergent services. That is really, at this point in the epidemic, that is the standard of getting a COVID test at all. You have to be ill enough to sort of qualify for the test. So if you are someone who is just sort of walking around and at home and maybe have a fever, but otherwise feeling okay, I mean, not okay, but just you're not in acute respiratory distress, meaning you're not having trouble breathing, you're eating okay, your mental status, you're clear, you're not kind of getting confused, you're not lethargic, you're walking around, you're ambulatory, you're walking around. For those people, the recommendation is, don't leave home. Imagine you do have COVID or you have some other infectious viral infection. Stay home, have, soup, wash your hands, clean your, make sure your areas are disinfected once a day, make sure you are staying clean, make sure you are separating yourself from other people, especially vulnerable people. There is no recommendation for otherwise healthy people who are stable to get the test just to know they have the test. This is really confusing to people because also, so we're saying don't get the test unless you're really sick. And if you're really sick, go to the ED. They're going to give you the test, most likely. But they might also say, yes, assume you have COVID, you are stable now. So while we're messaging that on the medical side, what you're seeing on TV are, drive up testing. So it's like, well, if they're well enough to be driving up, why are they getting a test? And part of those drive up strategies are to keep people from showing up in the ED, to keep people from showing up at Go Health just to know. When, again, back to this thing of, it's like, it just feels good to know. But one of the things that we have to recognize is that in the going to get the test, a person is now exposing all the people around them who maybe don't have COVID to potential COVID just for the sake of knowing. So really the recommendation is, if you don't need a test, if you are otherwise ambulatory, stable, not having those sort of serious symptoms that might require hospitalization, the assumption is at this point that you have COVID. You are going to go through all the sort of protocols and sort of COVID guidelines. And if you have no insurance and you have membership that are, physically struggling, as in any other time, in healthcare, they need to get to an ED because they need medical attention, and that is going to be delivered regardless of ability to pay.
Yeah, and I think that the thing I would add to that is that folks may even get the testing and still, be sent home and told to self-isolate. So it's like and that will still cause anxiety, because I feel like one of the common themes here is like, if you become sick or have these mild to moderate symptoms, like that you have to sit with this kind of like, well, I'm sick and now I have to isolate and it might get worse or it might not. So helping support people through that period is, I think, really what's part of the challenge, either when they get the test or even for some of the folks, that do get the test. It's, helping support them through that time. So, because otherwise they may feel, inclined to, go make 2 or 3 more trips to the ED to get the same thing checked out when they don't need to really be there. As far as the urgent care question, so the Zucker Hillside Crisis Center is open daily. Manisha was mentioning this too, from 9 to 3, and that they could go in for face-to-face. Cohen's urgent is still from 9 to 2:30, and folks can also walk in over there. However, if you contacted them ahead of time, they may be able to coordinate a home televisit with the family so that they would not need to come in. But if there's someone where you're looking for that, just you could email me directly and I could get you in touch with the urgent care folks.
Great, and I saw one more question came through. The question is, how do we speak to our older members who are now experiencing anxiety with the changes of not being to experience face-to-face visits and changes in their weekly routines? I'm an RC and I am expecting this at the moment.
Okay. Yeah, so I mean, as far as I think, the elderly population, I think that's true because they're vulnerable kind of in two ways. One, potentially if they have chronic conditions or other vulnerabilities of contracting the illness. So it's going to become super important for them to socially isolate. But then that doesn't solve the problem because now all the connectedness or other things that help them to keep going, is taken away. So I think to the extent that services are still available via phone, that could be very important, potentially, a weekly check-in, and it doesn't have to be from our single care manager. I mean, we could help kind of weave like a network of support. There might be other programs that are working with them as well that could check in with them too. But kind of scheduling a time and a specific routine, like this is when I'll be checking in with you, making sure you're okay. This is how you could reach me if you're worried or something is going wrong, and maybe trying to plan with them what are some other activities or tasks that they could do. Same thing with our elderly population. Tell them not to stay on the news all the time or to just keep on reading the paper, because that, again, is going to contribute to the anxiety. And when you're isolated and don't have a lot of support, that could really be a toxic combination. So again, just I think being more proactive in our outreach to those folks. I know, for instance, in house calls, the social workers there have been doing the collaborative care model, and those are face-to-face visits. But there's no reason why you couldn't continue those types of visits via phone and try to maintain that same fidelity with checking in. I hope that answers that question. Okay, and any other questions coming up?
So far, those are all the questions that have come in. I believe we've answered all of them. If anyone else has any other questions, feel free to send them in through the Q&A.
I think we went out for a second. Come up or no? Okay.
Oh, I'm sorry, you broke up for a second.
So, did I? Am I back in some reasonable facsimile of being understood?
You're good now.
Excellent. So I think if we don't have any more questions, I just want to again give a huge shout out and a thank you. This has been incredibly helpful. George, Manish, Ina, Max, thank you so much for putting this all together. I think that, the content, the questions were great. The other thing I really like about COVID University and what I think we are going to find, as in many of these types of events, is that they do bring us closer together. So now I hope that you all sort of have some familiarity with sort of the excellence of Dr. Alvarado and Dr. Sapra, and how great Ina and Max are, and definitely reach out to those folks as you have different questions. Everybody, we are all willing to help, and we are all sort of doing this together. So again, just a big thank you to this team. Thank you time to listen in, and please continue the communication, asking the questions, getting the answers that are going to be important to you. So thank you. Have a great weekend, everybody.
Okay. Thanks, Sina. Thank you, everyone.